Hi, my name is Michele Tedder. I'm your host, and welcome to Dear Healthcare Provider, the podcast where patients, providers, and policymakers meet to have purposeful conversations about health and the issues that impact access to care and health outcomes. Today, I'm so excited because I have three wonderful guests to introduce for episode two. And I'm going to start with introducing Miss Millicent Gorham. Millicent was named the inaugural CEO of the Alliance for Women's Health and Prevention, or the initials AWHP, in March of 2023. Having been involved with AHWP as the chair of its board of directors since its creation in October 2022. Millicent has more than 35 years of government relations experience, including as the health legislative assistant to Representative Louis Stokes, Democrat in Ohio, for 4 years, the coordinator of the Congressional Black Caucus Health Brain Trust, and a member of its steering committee for 18 years, the assistant director of government relations for the American Optometric Association for 8 years, and the director of government relations for the National Rural Health Association for 4 years. And we also have on our panel today Miss Tracy Zvenyach. Dr. Tracy Zvenyach is Director of Policy, Strategy, and Alliances at the Obesity Action Coalition. In this role, she provides leadership in the development and implementation of policy, priorities, and strategy for OAC and represents OAC in alliances and coalition efforts to advance obesity care. She also serves as an adjunct assistant professor at Georgetown University, where she teaches healthcare policy and advocacy to graduate level students. Dr. Zvenyach's research focuses on health, economics, and policy research to address barriers to obesity care, as well as measuring diet quality of pregnant women receiving the Women, Infants, and Children's, or WIC, Supplemental Food Program. And finally, we have, as our patient guest, we have Mr. Ryan Tedder, who is the co-founder of Serenity Projects, a music production and artist development company. With a rich background as a music producer and artist development executive, Ryan brings a wealth of experience to the table. He's a graduate of Berklee College of Music. He's been immersed in the industry since 2009, collaborating with renowned artists, producers, and executives. He's honed his ability to spot and nurture talent early on in their careers. His expertise spans artist development and record label partnerships, earning him recognition as a Grammy-nominated and multi-platinum producer. So welcome to Millicent, Tracy, and Ryan to Dear Healthcare Provider. So, I always like to start this podcast off with something positive. And so I'm going to ask each of you to respond to this question. What brings you joy and makes you smile? And so since Millicent's on the screen, I'm going to ask Millicent. So some of you will be listening, some of you will be watching, but I'm going to ask Millicent to respond to that question first. What brings you joy and makes you smile, Millicent?
What brings me joy is when God answers prayers in the most unusual ways. And I just sit back and smile to myself and say, there you go, God. Thank you so much.
I love it. And so we'll go to Tracy next.
I think what brings me joy most are people. I love being around people. I love working with people, and also solving big problems. So the topic that we're discussing today is, I think, one of the most pressing health problems that we have in our country and that we have faced over time. So it's really an exciting time to be here with you.
Thank you so much. And last but not least, Ryan is here with me in the studio. So Ryan, I'm going to ask you to respond.
Happy Mother's Day.
Thank you, son.
Yeah.
I appreciate that.
Family and helping people realize their dreams.
Okay,
Yeah,
great,
yeah.
great. Thank you, thank you. All fabulous answers, very, very representative of your personalities, as I know each of you very well. So I appreciate that. Thank you so much. Well, now we're going to jump in, and we're going to get started with this discussion. And dear healthcare provider. I'm more than my BMI is our theme for the season 1 for this inaugural season of the podcast. And today I really want to focus on issues of access and equity, and it relates to obesity care. And both Millicent and Tracy have extensive experience in understanding the policies, the structural barriers that impact the ability for people to get equitable obesity care. And so we're going to jump right in, and I'm going to ask you this question so that our listeners can really get a picture of the advocacy that is needed and the work that is being done and still needs to be done. So my first question is, what are the major barriers that individuals living with obesity face when trying to access treatment, particularly in terms of healthcare infrastructure and socioeconomic factors? Now, it's a big question, so I don't know who wants to jump in first, Millicent or Tracy, but go for it.
That's a Tracy wheelhouse thing, all for her.
I'm happy to jump in. So we look into these issues a lot at the Obesity Action Coalition, and our survey data shows that our members face a number of these barriers to accessing obesity care. So everything from issues with providers, like not being able to find a provider who knows how to treat obesity, trouble finding a provider that is trained and willing to provide obesity care. And our members also report that, it's difficult to find a provider that doesn't show weight bias toward them as a patient as well. So they might not feel comfortable with their healthcare providers. And then in addition to that, there are other barriers that include not having insurance coverage for obesity treatments. Sometimes insurance policies explicitly exclude coverage for obesity care and treatments. Then there are also, things like high deductibles, high copays, co-insurance that people with obesity are facing that really stand in the way of accessing good quality obesity care.
In addition to that, I think that there are things like social determinants of health that are barriers to getting care. Transportation is a major issue. Daycare, pet care are major issues to getting obesity care and treatment. So people, particularly since I'm working with the Alliance for Women's Health and Prevention, particularly for women, those are major issues that have to be navigated.
Yeah. Thank you both. You both raise like so many issues, and you guys know I've been in this advocacy space for a long time, and I'm very open about my own story. And I've invited Ryan to come today because I thought his story is pretty profound and is an example of many of these things that you both have mentioned. And Tracy, you talked a lot about access to trained healthcare providers who actually even know how or feel comfortable treating the disease of obesity, lack of insurance, cost of medications, and the list kind of goes on. And Millicent, you bring up the issue of social determinants of health, which we know that intersects in no matter what chronic disease that you're dealing with, right? We cannot ignore the social determinants of health, like transportation, access to healthy foods, all of those things, right? There's an intersection. But I wanted Ryan to come and we have an interesting story about how we talk about his journey with living with obesity. And though we are in the same family, he's my son, I have had different access to care than he has for a longer period of time. So I'm going to give way to you, Ryan, to talk about your journey with weight and getting healthy, and what that has looked like over the past year or so, because I think that all of these things that they're talking, you have experienced. So I'm going to give way and let you tell us a little bit about your story.
Yeah, I made a decision that I really wanted to get serious about losing weight about a year and a half ago. I realized that I was like as big as I've ever been, and I really just looking in the mirror and saying to myself, it's time to do something about this. And my doctor prescribed me Mounjaro, and the insurance that I had at the time wasn't going to cover it.
Yeah.
I mean, point blank period. They weren't going to cover it.
Right. And do you remember about a year ago, you did what? You called me.
Yeah, no. So yeah, that's the story. So I call you from the CVS parking lot after going and picking up my prescription, and they said, "Hey, buddy, your insurance does not cover this medication. It'll be $1,000." And I said, "Oh, so my rent will be it's my rent to pay for this
Your
medication,
rent, right?
And so that's you know, I'm not gonna do that." So went down this whole process of switching insurance, which was a whole thing in itself.
It took how long?
6 months, at least. It might have been longer than that. Finally get my insurance switched. And upon me getting insurance, which now costs, a bit more monthly, plus the copay for the medication, the supply was out. But before the supply was out, the issue was that my insurance only had partnerships with certain pharmacies. So that narrowed me down to probably about 2 or 3 in the city to choose from. And once I got the information, they're like, "Hey, buddy, we're out. We're out everywhere." And so it took me being persistent for about 3 days to finally track down a supplier that had it. And, taking the medication has helped tremendously. I want to go up a dose after having success with the first dose. Now they're out of that dose. And so
I'm going to stop you and say, Ryan and I have these conversations because I usually get a phone call from Ryan whenever these issues come up, and so he's like, "Hey, Mom, like, what do I do?" And so he says to me in that particular second conversation, which, mind you, was only about month and a half ago, something like that.
Literally.
And he says, "Mom, I feel like am I doing a drug deal or something? Because I feel like this negotiation and trying to find and search it feels kind of like a drug deal." And so we laughed, and I say to him, "Well, welcome to pharmaceutical Hunger Games, because this is what it feels like." So anyway, I'm sorry.
Yeah, no, it's what I didn't realize is that, and I even have privilege because I have an insurance that will cover it. I'm probably in a small percentage of people that have insurance that will cover this medication. But even with that, what blew my mind was what you pointed out to me, is that these companies have sister medications that are the exact same medication, but my insurance will pay for those exact, the exact related medication. If Mounjaro's out, but what's the
there's Mounjaro and there's Zepbound.
Yes, Zepbound.
And
the fact that my insurance won't pay for Zepbound but will pay for Mounjaro is confusing to me, because it's the same exact medication. So if Mounjaro's out and you guys have something that does the exact same thing as that drug, but you won't pay for that, just based upon your bylaws. That doesn't impact y'all, it impacts me. It impacts us. So, those dynamics confuse me, and I get concerned because a lot of people are in this position where you're on a medication and show you're improving, you're losing weight, you're feeling better, and then boom, supply's done. There's an alternative in the same exact company, but it's not accessible unless you pay out of pocket for it. It doesn't make any sense to me.
Wow, that's powerful.
Yeah.
Yeah, that's powerful. And I think, from a patient perspective, and you're just confusing, like that's I think such a profound way to describe it. When you're sitting on the side of the patient, you're like, wait, there's something available to me that can help me to improve my health, to live a better life, so that I am not a burden on the healthcare system, but I can't access it because of the weirdness or strangeness
Yeah.
of how this is set up for the same medication.
Yeah. It does the same thing. It operates the same exact way.
Yeah.
And I'm not a pharmacist, I'm not a doctor, but but from my understanding, the only difference in the medication is the name.
Yeah, exactly.
That's
So I'm gonna go back to you ladies to talk about this, and I'm gonna pick on you, Tracy, because I know that at the OAC, and we both do a lot of work within that organization. But can you speak to us about this conundrum that patients are facing, including, myself, and I live with obesity. And again, I'm open about that. I also take the medications and have not had as much difficulty as my son has in terms of getting on it. But can you speak, Tracy, to the policies and the structural issues that are in place that is causing this kind of confusion for patients who need the medications, benefit from the medications, but we have these pipeline issues. Is it Zepbound? Is it Mounjaro? And the different reasons why people can get it and how doctors can prescribe it. And then, Millicent, you can certainly jump in because I know you have certainly your thoughts about all of this as well. So I'll go to Tracy.
Yeah, no, we similarly, we hear from our members at OAC on a daily basis about issues around affordability, issues around supply and accessing the newer medications, and a lot of the problems do stem from policies that are in place at both the national and the state levels. So for example, at the national level, at the federal level, there's Medicare policy, and Medicare policy has a couple of gaps and barriers for obesity care. One on the intensive behavioral therapy side, as one of the evidence-based treatments, there are gaps in the types of providers that can provide intensive behavioral therapy and where you can receive the care. So there, on that side of the care spectrum, and then in Medicare Part D, which is the prescription drug benefit, there's a full prohibition on covering the FDA-approved class of medications to treat obesity. So that's actually one of the root policy problems that has a ripple effect across other types of health insurance and payers, that where we see a lot of the other exclusion policies around obesity medications aren't covered, period. So there are advocacy efforts happening today around a piece of legislation in Congress. It's called the Treat and Reduce Obesity Act. It would correct those gaps in Medicare. So that's one major effort that we have on the policy side. And then at the state level, there are opportunities to address barriers through Medicaid coverage, also through coverage for the Affordable Care Act exchange marketplace plans, as well as state employee coverage, as well as even employer coverage. Ryan, you mentioned you're lucky to be with an employer that offers coverage. Well, right now, only about a quarter of employers offer coverage for obesity medications. Now, we're hoping and we expect that to increase, but you're kind of lucky if you work for an employer that offers this type of coverage. And then, we could go on. I mentioned intensive behavioral therapy, but there's also surgical coverage is very limited and variable depending on the type of health insurance that you have. So really, the policy and the health insurance coverage are very closely tied together and are rooted in so many of these barriers, and whether or not someone has access to obesity care. And health, our good friend Patty Neese says often, health shouldn't come down to luck.
That's right.
That's right.
That's Yeah, that's so powerful. I think that for our listeners, what does this mean in terms of, some people purchase their health insurance off of the marketplace. In fact, we do, but we live in Pennsylvania, and so we live in a Medicare expansion state. So that has been honestly part of the saving grace for even Ryan being able to get medication and treat his disease because, but the fact that he had a plan prior just last year within the marketplace that did not cover, but again, through an insurance broker who understands all of the access issues, was able to help Ryan to pick a plan that he could get full coverage to treat obesity. And so I know, Tracy, you and I have been on the Hill, and so has Millicent, really advocating for the passing of TROA, Treat and Reduce Obesity Act, because, we live in Pennsylvania, but there's almost half the population is living with this disease. All of them don't live in Pennsylvania, and many live in states that they cannot get access to this care. And so I guess what I want our listeners to hear from you all is, what can they do? Like, how do we, because we have to work together on this. We can't, it's you or I, our voices are important, but it's the collective effort of everyone who's living with this. So can you guys speak to that? Like, what are things that people need to know and do in terms of moving the needle and creating the equity across the board? And maybe Millicent, you can speak to that. Mm-hmm.
Sure, thank you. So let me just expand a little bit on Tracy's remarks. She talked a bit about Medicare, but let's go to Medicaid. Only 16 states offer anti-obesity medications. So what we just in the state of Colorado this week, the legislation went before the state of Colorado and it died. So that means we're back at it another year next year in trying to make sure that there's comprehensive obesity care and treatment for Medicaid beneficiaries. So when you look at it from that standpoint and the number of states we still have to go, to 44 more states, and plus the trust Washington, D.C., and the trust territories as well. That's a lot of people that still need to get comprehensive obesity care. Then you take a look at the state employees. So the state of North Carolina just rescinded, back on April 1st, rescinded its benefits for those who are on anti-obesity medications to be able to continue to be on those anti-obesity medications. So you're talking about a good number of Medicare beneficiaries who don't have it for obesity. Now, let's look at it from the standpoint of chronic disease. Let's just acknowledge that obesity is a chronic disease. That's where we need to go first. So all the healthcare providers that will be seeing us and listening to us, please, let's just acknowledge that obesity is a chronic disease, just like high blood pressure, just like diabetes, just like cancers. And so we need to make sure that they understand that these are issues. Comprehensive obesity care is a major issue that helps to deal with the high blood pressure, the diabetes, and the cancer. So if we look at it from that point of view and get our healthcare providers to better understand that there is a direct relationship between obesity and all the other chronic diseases, I think will go a long ways to helping us with that. Now, the Alliance for Women's Health and Prevention put together a wonderful campaign called the Everybody Covered campaign. And one of the things that we are doing with the Everybody Covered campaign is to advocate for TROA, the Treat and Reduce Obesity Act, on Capitol Hill. We're doing it within the states as well. But the one thing that our campaign is going after is to help women, educate women, first of all, on obesity and all of what that portends, getting the treatments that they need, but more importantly, having discussions with their employers and with policymakers about providing comprehensive obesity care and treatment. That's at least one level of what the Everybody Covered campaign is all about.
Yes, and thank you for elevating those points, Millicent. And I just kind of want to recap because you had said some very important nuggets there in terms of how healthcare providers see this disease, right? It's quite varied. All three of us are nurses. And so we know, because we got the inside scoop, so to speak, that every healthcare provider, PCPs, don't necessarily see it as a disease, right? So it's really important for that message to continue to come through from patients, from policymakers, from those of us who are healthcare providers who understand and know that, because the disease of obesity is linked to, so many other illnesses, and you mentioned several of them: high blood pressure, heart disease, cancers. There's all kinds of things, and so it's almost like, so if we treat the foundational issue, we can avoid and save costs, because I know everybody wants to talk about cost, and it's so expensive to treat obesity. It's like, well, it's very expensive not to, so the complications and the comorbidities that come along with it when it's not treated is costing our country literally billions of dollars. And so I think that you both raise such good points, and Millicent, you really highlight the importance of us all being on one page about that as healthcare providers, as patients, as policymakers, to be able to move the needle that everybody is covered. And I'm glad you mentioned your campaign, and we'll also be including that in the show notes of how people can get behind that effort as well. So I want to say, we do a lot, and we're all women here, but Ryan, you as a guy who is living with the disease of obesity, can you speak to us just a little bit about what that's like from your perspective?
Yeah, I mean, here's the culture of, I can speak as being American, but I really think it's a world culture thing, honestly. But as an American culture, our food, affordable food, is usually not the healthiest food. Mm-hmm. Right? Mm-hmm. There's a stigma that's like, well, if you're obese, it's because you're not doing what you need to do.
Oh, the blame and shame.
It's like, you're obese because you're not trying to not be. Mm-hmm. And it's like, that's not necessarily true. Like,
right.
You could really be doing what you need to do and make those changes with your lifestyle, eating healthier, getting exercise. Mm-hmm. Yes, it does help the process, but it's not necessarily the only tool that's necessary for the bigger picture of the end goal, right? And the medication, the whole purpose of any medication is to be an assistant to the goal. Mm-hmm. But I feel like there's a stigma that, like, well, if you would just work harder, you wouldn't need this medication. If you would just stop eating whatever, fill in the blank, And so the conversation is basically like, you get looked at as lazy, you get looked at as, there's a stigma that you're not the same.
That somehow you're less than.
Yeah, exactly.
Yeah, you're less than, and that it's your fault. Absolutely.
Correct.
And I think, and we don't have time to talk about all of it on this podcast today, but I mean, we all probably have stories about how that bias has come through in the healthcare system with physicians. I've got a couple stories. I know you have stories, and even growing up and things like that, but how that impacts. But I think the point of that is what has shaped the narrative in our society, and that is what perpetuates all of these other things that we're talking about.
All of you have been saying obesity is a disease. That is not a phrase that is a part of culture yet. You know what I mean?
Yeah, absolutely.
Like, obesity is a disease. A lot of people are like, obesity is not a disease, you're obese because of, and then that's the conversation.
Yes.
I mean, some of the comments maybe on this podcast might be like, this is, so the reality is that,
right, they might come for us, right?
Yeah. So the point that I'm making is that educating people that obesity is a disease, and like there's a lot of factors to obesity. It's not just a conversation of lack of discipline or laziness. There's very disciplined people, very hardworking people who deal with obesity. You know,
and are doing all the, as I say, the things.
Correct.
They're doing all the things, and I think we can attest to seasons in both of our lives when we were doing all of the things, but the things weren't making the weight change at all, right? Yeah. So, but I think that back to what Millicent, I'm going to let you speak. So it looked like you wanted to say something, but I think that back to what everybody's saying is this is even the more reason why we need the education. We need to be able to help to change the public narrative about what this is, so that we can get the care that we need, that everybody can get the care that they need. Absolutely. Go ahead, Millicent.
I just want to go back to barriers for 1 second that relate exactly to what Ryan is talking about. So one of those barriers is, and Tracy mentioned it too, is in terms of provider education. I think one of those barriers is to make sure that change the policies, however that is, within the med schools, within the nursing schools, within whatever the healthcare provider schools that there are, to make sure that they're also providing more than 2 minutes worth of education for their students. So if we're talking about all of the other chronic disease, they will learn a ton about high blood pressure, and they'll learn a ton about diabetes, but they'll learn 2 cents about obesity as one of those high risk factors. I think we need to have an educational point and moment within those accrediting bodies, within the schools of nursing, within the schools of medicine, for them to better understand this is one of those things that you all need to change, and to make sure that you're providing more education and training around obesity and obesity care.
Absolutely. That's a great point, Millicent. Thank you for highlighting that as well, because you're exactly, it starts at the education level, right, in the schools, with training healthcare professionals. And we don't talk about it. I know when I was in school, and that was a while ago, so, I'm going to date myself. But at any rate, I don't remember us specifically talking about that. I do remember learning about diabetes, and I do remember learning about high blood pressure and all of that.
The complications of obesity.
Yeah, but we didn't talk about that. So I don't know, you and Tracy probably didn't have that experience either. I don't know, Tracy, you want to chime in here?
Yeah,
I just want to say, I'm sorry, Tracy, I just want to say one thing for your listening audience. Of the three of us, I am not a nurse. Now, I spent 27 years as executive director of the National Black Nurses Association. They gave me an honorary fellow into the American Academy of Nursing, but the true folks are on this line.
Well, thanks for clarifying that. See, I've inducted you into the nursing field here, Millicent. It's all good. You're one of us. You're one of us. So, Tracy, you were about to say?
Yeah. So, I completely agree. Weight bias is holding, negative attitudes and beliefs about people's weight. And that is keeping people from seeking care. And it's also keeping the healthcare professionals from offering care. So it's double-sided. And ultimately, that's directly harming people living with obesity. And just to re-emphasize the point that, the science is clear. Obesity is driven by powerful biology. It is not by choice. It is not a personal failing or a lack of character. It's physiology. So that it's
hormonal for women.
The education, that education piece is so strong. And I think one of the most important ways of educating people is sharing stories, sharing your personal experience. Personal stories are memorable and they're powerful. And that is exactly what we at OAC have been doing for 19 years, but how we really advance change is through sharing those personal experiences and sitting down at the table with decision makers, sitting down at the table with policymakers, and they need to hear from people living with obesity so they understand how important those changes are that are being proposed in policies or within employer groups or within communities, how much it means to people's lives. So that is I think my call to action is we need to hear voices, we need to share stories, and we need to just continue to build momentum toward these changes.
Yeah, that's great.
I'd like to
I'm
echo
going to
that.
say, go ahead, Millicent.
No, I would just like to say thank you so much, Tracy, for talking about the storytelling. I'd like to echo that within the Everybody Covered campaign. If people would like to go to our website, everybodycovered.org, there is a place for you to tell your story. You can make 3 clicks and you can tell the story using whatever device that you want to tell. You can talk about your own journey living with obesity, or it could be with about a family member. So we welcome people going to that website to tell their stories.
Well, wonderful, Millicent. I'm glad that you brought that up. You got ahead of me a little bit, because my next question was going to be to both of you. How can advocacy efforts influence policy changes to improve access to care for obesity? And are there successful advocacy campaigns or initiatives that have made meaningful strides in this regard? And Millicent, you just talked about the Everybody campaign that is going on, and we'll make sure that the information is in the show notes as well. And Tracy, are there things that you'd like to share as well, other campaigns? Because I know the OAC is doing a lot of things around this area, but I want our listeners to understand how can they get involved in these advocacy efforts, and how can their voice really move the needle for getting equitable access to care?
Yeah, so the Obesity Action Coalition, we've been doing advocacy for the last 19 years to try to improve access to obesity care, as well as reduce and eliminate weight bias and stigma. And we advocate for the full spectrum of care. So all science and evidence-based treatments is what we advocate for. And we do this through a number of ways. We do it through increasing awareness about the disease. We do it through education around the disease. We do it through advocating around policy proposals and topics, and we've talked about a couple of those today. And that's just central to, kind of the heart of our organization. And we have a really strong advocacy base in our group. Welcome everyone to check out obesityaction.org. There's a bunch of advocacy resources, how you can get involved. We have an action center with lots of different opportunities to share your voice, share your story on specific state issues or even the federal issues like the Treat and Reduce Obesity Acts. We have lots of opportunities to get involved. You can reach out to us directly if you want to get involved and learn more. We have advocacy trainings that you can participate in. We have advocacy videos that you can review and learn from. So many tremendous opportunities to get involved with OAC. And we welcome people at all levels. If you're just interested in wanting to explore it, or you've done it before and you wanna get back into it. So we welcome anyone in their journey on interest in this space. And we have a lot of activities. We've been collaborating with a lot of groups, including Millicent's, around trying to improve obesity care through the Biden administration as well, with improving access to care within Medicare and Medicaid. And then, of course, we're working on Capitol Hill as well to try to pass legislation. But, it's a really exciting time, I think, to be involved in this space. There's a lot of momentum, a lot of awareness and urgency really to create change, and that's really bringing our membership and a lot of people hope that there are opportunities for things to get better for people living with obesity and improving those care options.
Absolutely. Yeah, thank you for all of that. So, to our listeners, there's a lot of opportunity for you to get involved, and, you'll be able to reference those opportunities that Tracy and Millicent both shared in the show notes. Now, I have another question that I want to throw out here to all three of you, and it might be a little loaded, and but are there disparities to access to obesity care based on factors such as race, ethnicity, gender identity, or sexual orientation? And how can these disparities be addressed within the healthcare system? So anybody want to jump in? Ryan, I see you smiling. Go ahead. Go
I mean,
for
it's
it.
just, I was talking about culture. So in America, there's a gap. We know there's a gap. Everyone acknowledges the gap. Poverty is a direct evidence of systems that have been in place very strategically. And of course, it affects literally everything. And so, I don't know the data on this. I mean, this is not my world. But
Your mother just dragged you here, right?
Yeah. So, but I do have a question, and just to tie into this point. What percentage of America is obese?
I think
Give or take.
it's almost 50%.
And out of that 50%, how many of them are black or brown?
You know what? I forget the stats, but it's pretty high.
I feel like we're the majority. I feel like we're the majority of that.
Brian,
Millicent, I'm
of
sorry,
the
what'd you say?
women, of the women, 57% of African American women are living with obesity, and 44% of Latino women are living with obesity. You know, 1 in 3, basically it's 1 in 3 of adult Americans are living with obesity.
Thank you. There's your data. There's your data.
there's the
Thank you,
data.
Millicent, for the data.
So,
yes.
obesity is a disease, right? That was the punchline of this episode,
Right,
right?
right.
How come people ain't trying to help people with a disease in those communities? Because I can go down the rabbit hole. I will not do that on your show.
Okay. It's okay. I mean, the show is meant to open up the discussions, Ryan. So,
Yeah.
But I know where you're going.
Yeah, I mean, it's all connected. You know, even the foods that we eat,
Absolutely.
the foods we have access to,
Absolutely.
everything's connected.
And how about walkable communities?
Correct. And food deserts in them.
Exactly.
Yeah.
Yeah. So we could go on and on, but we won't because we don't have enough time. But Millicent, Tracy, do you want to weigh in here?
Sure, let me just say a couple of things. One, in terms of stigma and discrimination against women, one of the things that our audience needs to know is that women who are living with obesity get promoted less, and they get 20% less in their pay. So if it's 20% less in their pay just because they're living with obesity, and then they're a woman, which means they're getting less pay than men in general, that goes a long ways towards our economy and what that means for our nation's economy, and our communities and our families. Let's just go on down to where the rubber meets the road. One of the things that the Everybody Covered campaign has put together is an activation hub. And within that activation hub, just like with OAC, you may be able to go there to sign on to a letter to send to your member of Congress. All you need to do is to sign on the letter and put in your zip code, and away it goes to the 2 members in the House and your senator. And so the other option is also to sign a pledge. The pledge basically says that you will advocate for those living with obesity and to send out social media content and other things that will help educate all of us. As Ryan has said, it's not just about, it's where the rubber meets the road. It's all of us. It's not just one segment of the population, but it's all of us that need to be educated.
Yes. Great.
So go
Thank you
to
for that.
Everybody Covered campaign, go to everybodycovered.org. That's where, like, for my last word.
Yes. So, and Tracy, I'm gonna let you weigh in, and then I'm gonna kind of summarize what I heard. But Tracy.
Yeah, no, just echoing here that, there's strong data to show that communities of color are more affected by obesity and the complications that come from it. We also know that women and women of color are impacted to a greater extent. Lower income communities, lower education communities, both higher rates of obesity. So there's really strong data to support all of that. And I can send you some of the some of the most recent reports from the National Health Statistics reports. But at the end of the day, like all individuals, all people should be treated with respect and without discrimination or bias in healthcare, and no matter what their body size or their disease status, their race, their ethnicity, their sexual orientation. So healthcare providers, policymakers, culture, society in general, we need to be more educated on this issue. We need to be also further educated on how racism plays into this, how gender identity plays into this. And it's, it is ingrained in our culture, like Ryan mentioned. And, these are topics and conversations that we should not shy away from. We should talk about them more.
Absolutely. Absolutely. Thank you for that. And yes, that's I think maybe another episode, Ross, Ryan, we could talk about, because there's so much to unpack there. I'm going to throw this out here. What role can interdisciplinary collaboration play in improving care for individuals living with obesity, particularly in coordinating between primary care, specialty care, and community resources? And so I know we've talked a lot about needing to, at the academic level, educating healthcare providers in their training. We've talked a lot about folks who have been practicing for a while, kind of re-educating various disciplines around what obesity is and what it isn't, despite the fact that the AMA declared it, a disease, in 2013 or something like that. So what are the things that, from an interdisciplinary collaboratory way, because, as healthcare providers who may be listening to this podcast, what can we do as professionals, and how we intersect with the community, how we intersect with these cultural nuances? What do you guys feel we could do?
I mean, I would say that, the model is there, right? If, as we know that obesity is a complex chronic disease, just like heart disease, diabetes, or cancer, like obesity should have the care coordination and the services and the supports that patients need, to improve health outcomes and well-being, wherever someone is on their care journey. We don't expect patients with cancer to go figure out where they have to go, what treatment they need, where they can get it done. But we do that with people with obesity today. That's kind of, a lot of people have to navigate and figure out that journey on their own. So with improvements in education, with improvements in policy and coverage and access to care, the model is there. We can then apply it to people living with obesity.
Wow. There was something you said earlier, Tracy, about the gap that's created because people, for various reasons, probably because of weight bias, we probably argue, don't want to seek care, and sometimes providers don't want to provide the care when it comes to obesity. And I think that impacts the lack of care coordination, right? Because those of us who work in this field, for a long time I did mental health. That's my clinical background. And I remember we worked in the clinic that I worked in, we had a coordinated team. So if somebody needed meds, we knew where to refer them. If somebody, needed additional counseling, we knew where to refer them. Or we had it in-house, actually. I was blessed to work in a clinic that we could do a lot of that stuff. But I think that, to your point, with obesity care, we expect people to just figure it out. Ryan's in a parking lot calling his mother, who's an advocate, to say, hey, what do I do? How do I navigate this? How do I get this? But what if Ryan didn't have a Michele Tedder in his life? Like what if, and many people don't, right? Or we didn't know a Tracy, or we didn't know a Millicent to know how to navigate this. So when we're talking about, coordinating and just the interdisciplinary collaboration and working with communities and even our organic folks in the communities who are the ambassadors and messengers, how do we equip people with what is needed to get people the care that they need, and not this fragmented word I'll use, fragmented way that we expect people to do it. And I think many people probably just give up at some point and say, you know what, forget it, whatever. I don't have it.
I understand how.
Yeah, you understand that, right?
It's like a 20-step process.
Right. So exactly. So what can we do, and how can we equip our listeners with some tips and tools for if you're in this situation, if you're in the situation like Ryan was in, and you don't have a mom, you don't have a sister, you don't have somebody who tell you, here's step A, step B, step, the things that we do. How can we equip people with the tools necessary to get what they need?
I think that one of those tools and people that we can use, people that we can use in our communities to help us are community health workers. And I think the community health workers, while they better understand what's going on in their communities and the resources that you can be directed to in your communities. I think the other thing is that as Tracy says, there are models, and there are models of interdisciplinary education. And so I take that back to the med schools and the nursing schools and pharmacy schools. They all need to have times where they are learning together about some of these issues, particularly the issue around living with obesity, and that there is navigation that can be done. We know that, at least in America's healthcare system, that the nurses spend more time with the patient than anyone else. And then the nurses need to be able to navigate over from what's going into that medical record to have that conversation with the provider, with the primary care provider or the specialist, and to make sure that that's documented in the medical record as well. And so when we're talking about women particularly, it's across the life stage, from menstrual time to having babies to post-menopause. Those are straight across the woman's life cycle, are reasons why they are hormonal reasons why, medical reasons why, scientific reasons why, clinical trial reasons why they are gaining the weight and being overweight and living with obesity. And so we need to make sure that we're having those kinds of crucial conversations across the life spectrum for women.
Absolutely.
And
Tracy,
I would just add that we still have a long way to go here for helping people know how to navigate this journey and be able to access quality obesity care. But I will say that it's one of the main reasons why Obesity Action Coalition exists, right? We have a lot of good resources to help point people in the right direction. One of them I'd highlight is Obesity Care Provider, our Obesity Care Provider lookup tool, which is essentially a database of obesity care providers, whether it's someone in nutrition counseling or intensive behavioral therapy, like a registered dietitian or a clinical psychologist, to then an obesity medicine specialist, all the way through, metabolic and bariatric surgeons. We do have a database of these providers who have been verified, and we looked into their practices, and they are the data set represents legit. The whole country.
They're legit, right? Right.
From the best that we've been able to verify, and the information that they've submitted and we've verified. So, by zip code, someone can search up, who's available around me, who might I be able to, get help from. So that is one small resource, that we would always encourage, people seeking care. You can definitely check that out.
Absolutely. Yeah. And again, we'll have all these details and these resources and links in the show notes. But I think that one of the things I want to always make sure that this podcast amplifies is the fact that living with obesity requires comprehensive care and comprehensive access to care, right? Because this is a mind, body, spirit disease, and you need all the tools in your toolbox in order to deal with it. And so that means, behavioral health resources, access to medications, resources for, obesity medicine specialists or PCPs who aren't afraid to tackle this issue. So, you need all of the, exercise options, all of those things. And Ryan, you were bringing that out before, saying that, you need to be able to do all of the things. It's not one thing, and so it's like the medication is a tool, exercise is a tool, having access to healthy foods is essential, all of those things. So, being able to elevate that message that this is not a one and done issue. It is not a one size fits all issue, right? And that people deserve to have access to the full spectrum of care that we know it takes to treat a disease like obesity. And so as we come to towards the end here, I want to throw this question out, and then I'm going to give you all opportunity for some final thoughts and statements. But looking towards the future, what are the most pressing priorities for advancing equitable care for people living with the disease of obesity? And how can stakeholders across the healthcare spectrum work together to address these challenges? Now, that was a big one, but I would be curious to know what your thoughts are. Ryan, your perspective as someone living with it as a patient, and knowing what you've had to navigate. How do you think people can kind of work together, stakeholders that we're talking about?
Well, it's just conversations like this. It's just about being transparent about what the reality is and what needs to change. Accessibility and how that ties into all the other things that we talked about during this conversation. I just think that storytelling is the first step to changing anything.
Mm-hmm.
So
thank you for that. Ladies, your thoughts?
I'm happy to jump in. I think there's no one solution to fixing the obesity problem. There's all levels, from individual, families, communities, systems, all the way through policy. We need to make comprehensive and meaningful efforts, I think, at all levels. But I'll just end with, we also need to be respectful with words and images. Stop blaming people for living with obesity. Stop shaming people living with obesity. Using images that are respectful around how in journalism and in news, people with obesity have heads. People with obesity are not just people with obesity are portrayed in really negative ways, and that's just not reality. That's not respectful, and that's not representative of who people are. And so I think we need to make lots of coordinated changes in respectful and meaningful ways to address this kind of for everyone that's living with this, and those that are that are affected. And I'm hopeful and excited to be part of this work.
Thank you for that. Millicent?
Sure, thank you. So, as in the name of the Alliance for Women's Health and Prevention, we need to have more alliances and more coalition partners, working with the Alliance for Women's Health and Prevention and with OAC to get this work forwarded and carry on the momentum to make sure that everyone, particularly women, can access the full spectrum of obesity care and treatment. One of the things that's important to us is that access component. As you mentioned earlier, it's making sure that we can get to the primary care providers, to the specialists. But how do we go about doing that? Those access points need to be expanded. You know, our nation is not going to ever be able to have all of the millions of healthcare providers that we actually need in this country. So we're going to have to find other ways of providing that access. And some of that might be through telehealth. But even with telehealth, and going back down to that issue that Ryan brought up about economics, you need to be able to lay the lines for the broadband. In order to lay the lines for the broadband, you need to train workers. And if you're going to train workers, you need to train some women too to learn how to lay down the cables so that we can have broadband access, so that we can have access to more healthcare providers through telehealth. And that's one of the things that I will point out as well.
Absolutely. Well, those are all great points. And I think that it's an exciting time in doing this work. We have a lot of work to do, but I think that, as all of you have pointed out, that storytelling, having these types of forums, podcasts, to really talk about the issues at both the personal level as well as the policy level and the provider level, that if we all can work together, right, that we can move the needle on this. And hopefully in the future, we have a world where we have a different conversation. We're talking about the strides that we've made, and it's something else that we've got to solve. But for now, we all come together and we work in this space. And so with that, I'm going to say to all of my guests, Millicent, Tracy, and Ryan, thank you so very much for taking the time to share your personal stories, your personal insights, your expertise. And I hope that to our listeners that you have gleaned something out of this episode that can help you in your weight health journey to access the care that you need. And we'll continue to have these discussions. So stay tuned for the next episode. And in the meantime, as we sign off, I wish you joy, I wish you peace, and I wish you good health. Thank you.